Hello, we're here for the Palpation Lab with my mom, Lisa. So we are just going to get started. So we're going to start with the sternoclavicular joint, which is where the sternum and the clavicle meet. So I'm going to just feel for the clavicle right here, and then this bump right here is the sternoclavicular joint. We're going to feel the different kinds of glide. So first I'm going to have you raise your arm like this into flexion. And then you can feel with that, there's inferior glide, and then if you move your arm back like this, so move it like this, up and then back. So now she's in extension, and with that, the joint moves into superior glide. And then now we're going to do horizontal adduction, so move your arm across your body like that if you don't mind. And that would be posterior glide, and then the opposite of that, horizontal abduction, would be anterior glide. So we already felt for the clavicle, but it is right here. It's medial to the shoulders, above the sternum. Jake, you can come by. I just started. So that's the clavicle right here. Next, we're going to feel the acromioclavicular joint, which you just follow the clavicle until you get to this flat part, and right in between it there should be a bump, and that's the acromioclavicular joint. And again, with that we can feel two different types of roll. So if you move your arm into flexion again, then there is posterior roll, and then to extension, then there is anterior roll. So like before, you can put your arm back to where it was. Thank you. And so the roof of the shoulder is the acromion. It will feel like a flatter part laterally to the acromioclavicular joint. And then if you drop down into the subacromial space, it'll feel like a little drop here, and then inside of there is the head of the humerus. Actually, we can probably turn you sideways a little bit. That's good. Thank you. Mm-hmm. So right in here you can feel the head of the humerus. Next, the deltoid tubercle is where the anterior, the lateral, and the posterior ends of the deltoids meet into a space called the deltoid tubercle. And then you've got the two hills in a valley. That would be the greater tubercle, which is where the supraspinatus, infraspinatus, and teres minor meet, and that's on the lateral bicep right here. And then in between them is the bicipital groove, and then posteriorly would be the lesser tubercle, where the subscapularis is at. I think. So next there is the coracoid process, and so if I feel back on the acromion and then go into the subacromial space, feel the humerus, and then if I move around and fall anteriorly off of the bicep head, right in here you can feel a bump, and that's the coracoid process. And that is where the short head of the bicep, coracobrachialis, and pec minor meet. And so now we can turn you around, if you don't mind. Okay, I'm going to move your hair out of the way. So next I can feel the spine of the scapula with an open hand. Feel this is where the trapezius, posterior deltoid, and those both attach. So it will be the furthest thing sticking out on the scapula. And then I can feel superior to it is the supraspinous fossa, where the supraspinatus attaches, and inferior to it is the infraspinous fossa, where the infraspinatus and teres minor are at. And then the medial border of the scapula is right here on the side, where the rhomboids attach medially from the spine. And then the lateral border, if I just follow down, you've got the inferior angle, superiorly you have the superior angle, and then if you follow that around you can feel the lateral border of the scapula where the teres major and minor attach, and then the subscapular fossa would be underneath that, under the lateral border, which you can find, but I'm not going to right now because I don't know how to and I don't want to hurt her. So next, on the elbow, you've got the farthest tip of the elbow would be the olecranon process, and then you can feel the fossa is this open space, and if she extends her arm, you don't feel it anymore, and that's how you can tell it's the fossa. That's where a lot of the triceps all the tricep muscles attached to the olecranon process. And then I'll have you turn back around. Thank you. So now we will feel for the epicondyles. If you can have your arm in supination like this. I follow the humerus down to these two tips that stick out on either side, and those are both of the epicondyles on the medial side and on the lateral side. The supracondylar ridges are just superior to the medial and lateral epicondyles. And then the head of the radius, if we turn your arm back around. So the radius is on the lateral side. If we turn it around, it's still over on the side. And on the back, you can feel that it's inferior to the lateral epicondyle posteriorly, and that's where you'll find it. So back on the anterior side, if I have you flex your arm just a little bit, try to flex your bicep a little bit, you can feel the bicep tendon, and then you can relax again. So you can feel that anteriorly, and then at the end of the tendon is the radial tuberosity. Another thing to mention, you got the radius on the lateral side and the ulna. On the medial side, the ulna stays stationary, but if she rotates her arm, or rotates her wrist into pronation, then you can tell that the radius moves over the ulna. Next, we'll feel for the styloid processes. So the styloid process of the radius on the lateral side drops off into the scaphoid. So you can just follow the radius down till you feel it drop off, and then right there would be the styloid process right proximal to it. On the other side is the ulnar styloid process, and the same, you follow the ulna down into the space between it, which would be where the triangular fibrocartilage complex would be, and just above that, just proximal to that, would be the styloid process. Now, if we move to pronation and move from the radial styloid process over medially, you can feel Lister's tubercle. And now we'll scoot up closer so we can do the wrist and hand. Okay, so we'll do this as best we can. Starting with the third metacarpal, you can move down the metacarpal to where you feel a little drop, and that first bone will be the capitate, and just proximal to it will be the lunate. And if you move the wrist around, you can feel that the bone moves separately. At the second metacarpal moving down, where it drops down would be the trapezoid, and then you've got the scaphoid right under that. And then from the palm, on the pinky side, would be the pisiform, the part that sticks out down here on the palm. And then you've got distally to that is the hook of hamate. Next, if we flip your hand back around again, we feel the first metacarpal down to the end. You can feel the, at the base of the first metacarpal would be the trapezium. And then if we go from the third metacarpal back down from the capitate to the lunate, and then move towards the pinky side is the triquetrium. And then if we do the same, moving down from the third metacarpal to the capitate, and then towards the pinky, that's the hamate. If we move back to supination, we can find that the space between the pisiform and the trapezium is the carpal tunnel. And then moving back to the metacarpals, we've got the head is distal at the knuckle, in between is the base, and then at the end, right before the carpal bones would be the base. Head, shaft, base. Then we've got the interphalangeal joints. These ones that are distal would be the distal interphalangeal joints, and then these ones would be the proximal interphalangeal joints. And then you've got the metacarpal phalangeal joints at the knuckles. And the rest of this we'll try to do turned around if we can. And then if you can hold your hair
Neck
to the
massage.
side. Neck massage. Okay, so I'm going to feel these as best as I can. We're going to try and find the transverse process. With that, you start with a flat hand and put it on the neck. Between the transverse and spinous processes. So that would be starting about right here. You can feel the transverse processes. C1 transverse process you can't feel, or C1 spinous process you can't feel. So you can also, if you flex your neck forward, I can feel for the first spinous process that I can feel, and that'd be C2. I move up from C1, and then you can put your head back up normal. If I feel for the transverse process, then I can move over and then find where C1 would be. Next, if you can turn a little bit sideways.
This way?
Yes, please. The TMJ should be in front of the tragus, and if you open and close your mouth for me, you can feel it moving. So that's the temporomandibular joint. The mastoid process is posterior from the bottom of the earlobe. It's the bone protuberance. So if I feel behind here and then have you open your mouth again, you can feel that is the mastoid process. The articular pillars would be posterior to the transverse processes. So if I feel those again with an open hand and then move, it's where it's less tender, and that's why you'd want to feel for those and follow those rather than the transverse processes. So next I'll have you turn back around to the back. And then the rest of this will be, on the back of your head. So I'm just going to feel for the bump, which is the external occipital protuberance, and it's the bump on the occiput. And then if I feel the horizontal line just superior to the external occipital protuberance, it'll go across here, and that is the superior nuchal line. Can I have you hold your hair again for a second? Thanks. Okay, so now I'm going to feel for C7. It'll be the bone that sticks out, and then if you extend your neck back, everything disappears except for C7, so that's how I know it's C7. You can put your neck back to regular. Thank you. So it's the first one to be felt, and the rest of the spinous processes of the cervical spine will disappear. And then the nuchal ligament you can find in the concave part of the posterior neck, and then if you extend your neck back again, it disappears, and then you can put your neck back to normal. And then, as I said before, C6 will disappear when she extends her neck back, so that's how we can know. And that's all I have. Thank you.